When we have a patient of acute macular degeneration, we should know how to manage this particular case of acute macular degeneration. The management starts off right from the fact when you're taking the history from the patient, and then you're going to focus on the clinical factors that are going to be helpful in diagnosis of the acute macular degeneration. And then finally, you're going to design a treatment modality for this particular patient that we're dealing with. Early diagnosis is very effective in a good prognosis and the better results or the better outcomes in a patient of acute macular degeneration. But you have to basically make the patient more aware of the disease and how is it going to progress. And again, the preventive measures that can be helpful in the slow progression of the disease, that this is all that you have to make the patient aware of. Even the general public should be aware of this phenomena, which is basically age-related. The age-related macular degeneration is very important, and one should be aware of these factors that are basically helpful in the prevention of the age-related macular degeneration, and that is what we're going to discuss over here in this very third section. So the systemic factors that are playing a pivotal role in the development of the acute macular degeneration that we have to focus on. It can be any systemic disease that the patient is suffering from. For example, any chronic illness. For instance, diabetes mellitus is quite notorious to be basically making the foundation towards the diabetic retinopathies and even in the macular degenerative changes of the patient. Then we have the lifestyle modifications that can be made in a patient of acute macular degeneration, and that are again going to focus on the fact that these lifestyle modifications are going to be helpful to slow down the progression of the disease. Future trends that are going to be quite helpful in the development or the prevention of the disease are again very important over here. The systemic preventions would include hypertension. Then we have the coronary and the vascular diseases. We have the statins that the patient, the long-term intake of statins can even contribute towards it. Diabetes mellitus is one of the disease that can basically contribute towards the development of this sort of macular degeneration, and genetics or the familial predisposition of a patient towards this development of macular degeneration is very important. Over here you can see there is a central kind of a vision loss that is basically due to the macular degeneration, and is a normal vision in a person that can be compared towards a vision in a patient with macular degeneration. The preventive measures, basically prevention with all of these factors, any long-term diseases, hypertension, diabetes mellitus, hypercholesterolemia, if the patient is on statins, these are the risk factors towards the development of age-related macular degeneration in the patient. Lifestyle modifications are again very important. The environmental factors can even contribute towards the development of acute macular degeneration in a patient. One of the factors can be smoking. So quitting smoking is one of the easiest lifestyle modification that would basically slow down the progression of age-related macular degeneration. The use of alcohol. Then we have the diet and the nutrition. So particular diets are quite helpful in the slowing down the progression of this disease in a patient. It includes basically the antioxidants, the use of lutins and the zeaxanthines. Then the polyunsaturated fats, they have to be avoided in a patient. The obesity is one of the risk factors for the development of acute macular degeneration in a patient, and then exercise. So the sedentary kind of a lifestyle in a patient is going to be helpful in the development of the disease. So it's again very important to start exercising. It can be a light exercise that can be devised, and quitting smoking, quitting alcohol, all of these easy lifestyle modifications can, these healthy lifestyle modifications can basically slow down the progression of AMD in the patient. Prevention, as we were already focusing on the fact, the other factors sometimes are again very important. It basically includes the cataract surgery in the patient. Then we have the sunlight exposure, sex hormones, even the gender is again very important. Females are more prone to the development of the AMD rather than the males. So this is one of the factors that can be any sort of trauma even or any sort of eye surgery that the patient has undergone will make the macular degenerative changes appear fastly in that patient. So all of this history is going to make the patient more prone to the development of the disease, the race and the ethnicity. It's more common in the Caucasians, and the educational status and the social class. So again, the low socioeconomic class is more prone to the development of the disease. No particular factors, or it's just depending upon the researches that have been carried out, and all of these factors are basically considered to be the risk factors towards the development of the age-related macular degeneration in this particular patient. So there are a lot of trending phenomena over here. It's again a diagram of an ophthalmoscopy that is being performed. This basically scarring phenomena is present on the macula, and it's basically a deciform scar that is present, and it is basically showing you the age-related macular degenerations in a patient. The newer drugs, beware of the dry macular degeneration, because the dry macular degeneration would not respond quite friendly towards these newer drugs that are being used. It's more of the newer drug delivery devices are being devised, and then we have the new diagnostics with better structural and the functional analysis. Just to diagnose the case more accurately and just to see what kind of a variety of the macular degeneration is that we're dealing with over here. The rehabilitation of the existing patients is very important, and new ways of working. So these are some of the future trends and future researches towards the acute macular kind of degenerations. New ways of working or the challenges. The new ways to follow up the ratios are very important. The patient pathways are again very important over here, and the IT infrastructure. So what are the newer ways? It's the IT infrastructure. It's the pathways that we can diagnose, or we can get a better outcome of these patients, and who's responsible for what. So it's again very important just to know your duties as a GP, as a general practitioner, and then you know your duties as an ophthalmologist. What kind of a referral form you're going to design for the ophthalmologist. Knowing your duties as a doctor is again very important, and this is the informative governance. So these are some of the future trends that you have to focus on when you have these cases of acute macular degeneration at your hand. Making the patient more aware of the disease. That's basically an age-related disease. These senile changes are going to take place, and then diagnosing the disease in an accurate way. Working as a GP, you should know that a chronic vision loss is related to a lot of diseases. It's basically ranging from cataract, glaucoma, diabetic proliferative changes, diabetic retinopathies, the age-related macular changes that can occur in a person. So you have to make a complete differential diagnosis, and then you can even refer the patient without making an accumulative diagnosis, without making a definitive diagnosis. You can make a referral form and just refer the patient to the ophthalmologist for the further reviews. So again, the lifestyle modifications, and you have to focus on the risk factors. Make the general public more aware regarding this disease of acute macular degeneration. What are the preventive measures? What are the lifestyle modifications? The healthy eating, exercising, avoiding smoking and alcohol. All of this is basically going to make these senile changes grow very slow, or the progression is basically hindered for this acute macular degenerative changes in a person. The extended roles in the secondary roles are very important. Virtual clinics, in which basically a lot of doctors are counseling patients on the internet just to make the patient aware about the disease and how to prevent these diseases. Optometrists have a very pivotal role. in this phenomenon, and GPs with special interests are important catchment areas, and then we have the vanguards. So all of these phenomena and all of these people, they work as a team towards the development of the awareness in the general public regarding the disease and regarding the prevention of the AMD in the patients. So that is the end of this section. Thank you for watching sqadia.com.